Hello, hello. Hi, Aria family. Thank you for joining us today. I know that we've got a Zoom link going out there. We're going to be live streaming from a couple different platforms. So wherever you're at, thank you for joining us. And I'll just preface this with, if you have any comments or questions, please drop them in the chat. We are checking them on all platforms. If it's a question that we feel is appropriate to ask to Abby to share with everyone, we're happy to do that. If it's more of a specific question for your specific situation, we'll make sure to get that question into the right hand so that they can answer it properly. But with that being said, I'm Crystal Ance. I am your Member Services Chair for 2024. We are super excited to be bringing back on Clearwater for another webinar to share some new things that they have going on. But as you guys know, at Member Services, our job is to make sure that we offer you the best member services, member benefits, and our committee kind of searches high and low. And we were super excited last year when we started the conversation with Clearwater to be able to bring health insurance as an option to all of our ARIA members. That was huge for us. That was something that we've been on the lookout for years. And to be able to find that right partnership has been so exciting on our end. And now they even have some more options for us. So not only the healthcare options that we had discussed in kind of some Zooms and webinars in the past, but we have Abby here today. So I'd like to introduce everyone to Abby Slaughter. She is the Director of Account Management for Clearwater Benefits. And today she's going to talk to us about the new holistic option that is out there. And obviously, especially on my end, I'm always like, I feel like they're trying to push pills on us. Going that holistic route is definitely a fantastic option. So with no further ado, Abby, why don't you tell us about what Clearwater has for our ARIA members?
I would love to. Thank you so much, Crystal. And I just want to reiterate that we are so honored to be partnering with ARIA to be able to provide your membership community with these not only the holistic options, all of the options, but to add 2 holistic plan options into the mix here for you guys. So I'm going to go ahead and share my screen and kind of dig into it. As Crystal mentioned, if you have any questions, they're going to monitor them in the chat, and feel free, Crystal, let me know if there's some that we can answer on the webinar here. And if not, we can always get your specific situational questions answered as well. So with that, I am going to share my screen here. All right. So we're mainly gonna go over the holistic options today. There is a little bit of information toward the end about the major medical options. As Crystal mentioned, again, she really hit the nail on the head. A lot of people feel like healthcare is pushing pills on you and very retroactive or reactive to your healthcare in general. So what we at Clearwater Benefits wanted to do was to provide you with some holistic coverages that will help encourage people to stay healthy and be well, to hopefully prevent some of these issues that can arise later on. So we are introducing 2 holistic plans with you today. And what they do is they seamlessly blend holistic and some conventional coverages in a new collection of revolutionary health plans. I will note that just because it can be confusing at times, the holistic and the ClearShare are health insurance alternatives. They are not your traditional major medical insurance coverages, but they are an alternative. If you have any questions on kind of what that means, we'll touch on it a bit. But again, anything, Crystal knows how to get in touch with me, and I'm happy to answer any of those questions. So we've had our partnership for a while now, and we've been off and running with some of the major medical plans. But what I'd like to do is kind of reintroduce you to Clearwater, go over some of the real costs of healthcare and how this can have such a big impact on you, not only your healthcare, but your financial well-being as well as your mental health. We'll dive right into the holistic plan options and then how you go getting that non-emergency care. And then there's a few wrap-up things at the end, and we'll show you how to enroll so you can do this either on your own, or you can book a free call with one of our benefits consultants who can help you make sure you are getting the right plan that meets you and your family's needs. So Clearwater Benefits, what we want to do is we want to offer our community the most innovative health plans on the market today. These plans were specifically built for you and by people who share the same values. So we do focus on preventative with the holistic plans, and there are some additional reimbursements and perks that come with that, which we'll go over. With that said, healthcare is a personal choice. No, we have access to everything on the market, even outside of Clearwater plans. So if we can help you with whatever plan fits your family's needs. Before Clearwater, benefits were very expensive, they're limited. What we've been able to do is kind of aggregate members to help keep costs down while providing really great coverages. A lot of the plans that you'll have access to on the marketplace outside of being a W-2, having access to a W-2 plan, the things on the marketplace, a lot of the times it's coverages that you don't need, and you're paying really high premiums for it and really high annual out-of-pocket maxes. And that we're at Clearwater, we just said, no, that's not how we want to work. And so we really took a look at what people were wanting, and specifically with entrepreneurs who don't have that access to the W-2 benefits, and with little to no customer advocacy. We have customer advocacy teams that are here to support you and work with your providers to help make sure this is a positive and seamless experience for you. So just a couple of terminology things I wanted to run through. And also it kind of shows you the average costs in America. So the premium for an individual, an employer is going to pay about $8,000 or about $24,000 for a family, while the member is going to pay about $1,500 and over $6,000 for a family. So the premium or the copay is what you would need to pay at the doctor's office for your visit. That's, in this case, $25 they're showing. You go to the doctor, your responsibility is $25. There is co-insurance on top of that after you meet your deductible, which we don't even need to get into in this webinar necessarily. But the deductible is what the amount of money that your family or as an individual you will need to meet in order to have some of those additional benefits. And then the out-of-pocket max is what in 1 year annually you are going to pay out of pocket. Like that's up to, and the average in America right now for an individual is over $9,000, and it's almost $20,000 for a family. I don't know a lot of families that have $20,000 set aside, or even as an individual who have $10,000 extra set aside just for their health care. Members who choose ClearShare alone save an average of 65% when compared to the industry average on premiums. This is kind of what I was talking about before with the access that you have to the healthcare plans on the marketplace. You're going to actually save money with ClearShare, with Clearwater, while getting better coverage. In addition to that, the average is about 80% savings when it comes to paying out-of-pocket costs. Plus, there is no network. For ClearShare and Holistic, you are not subject to a provider that is within network. You can see who you want to see. A lot of people who are already taking a holistic approach to their healthcare have established a rapport and are established with a practitioner. You do not need to stop seeing that practitioner to have these benefits. A couple of testimonials from people that have had benefits with Clearwater. One family, and I know Carol personally, their family is saving over $20,000 with this. They have a holistic plan. They have holistic plus ClearShare, and it's incredible because they're saving that much money. And they actually are using coverages that they want to use. Terry is one of our most famous Clearwater members, and after 12 weeks in the ICU due to some COVID complications, there were bills over in excess of $2 million. Terry was on a ClearShare 1000 plan. So what did Terry pay out of pocket total for all of that? $1,000. Because after that, it was a shareable need. So is this a good fit for you? It's pretty simple. Are you a 1099, an independent contractor, freelance, or small business owner, or member of ARIA? Do you need better benefits at a better price? And are you spending too much on your health plan? These are pretty basic categories to see if you're a good candidate. Even if you have a spouse that has corporate coverage, you could still look at Clearwater pricing and plans for the spouse and family and save some money. If you're not going to save money with us and the corporate plan is the best, our benefits consultants will tell you. They are non-commissioned, they are not salespeople, they are licensed, true consultants that want to put you in the best health plan for you. Okay, let's dive into the holistic part of the plan. This slide, there's a lot to digest here. The subsequent slides will kind of break it down a bit for you, but in essence, there are down the left-hand side, the different categories of coverages. And by that, I mean the preventative care, primary visit, specialist, chiropractor, and so on. Across the top, there are the two different holistic plans plus ClearShare. There's a holistic premium plan, which is going to have some additional coverages. And then we have a holistic essentials plan. The holistic essentials plan is also available as a standalone. And what I mean by that is you can have coverages that is just the holistic essentials without the ClearShare. We will go into that a bit more here in the subsequent slides, but I just wanted to call that out. The holistic premium is only available with ClearShare, and the holistic essentials is available with or without ClearShare. So let me just go down here. So for preventative care, we're just gonna go section by section and chat through really quickly the different coverages for each plan. So for the preventative care for the holistic premium and plus ClearShare, in network and out of network, and this may look confusing because I said there is no network for holistic. ClearShare does have some, there are some coverages that are subject to a network. However, if it is in network, it is $0. And for the holistic essentials, your member responsibility is going to be $20 per preventative care visit with a limit of 2 per year per person on the plan. Your primary care visits, this is beyond your annual checkup, and this is when you need to see your primary care. For the holistic premium, there is a $20 member responsibility per visit with a limit of 5 per calendar year. And then again, that is per person on the plan. So if it's you and your 3 kids, each have 5 visits. And with the holistic essentials, it's the same member responsibility, but it's just a bit of a reduced coverage to help keep costs down. So if you're generally healthy, the holistic essentials plus ClearShare plan is a great option for you. So when you're seeing your primary care visit, the holistic piece comes in when you can see an MD. However, it does include functional doctors. Your visit can be with a licensed naturopath doctor, a doctor of chiropractic with a DABC certification, again, an MD, like I mentioned, or a doctor of osteopathic medicine that specializes in functional medicine. The visit itself is going to be covered at up to $150 per visit. Costs over the $150 are the member responsibility. And so kind of what I mean by that is you pay $20 for your visit, and if they're adding on other services, things like that, ClearShare, the holistic portion, we will cover your visit at up to $150 each visit. For a specialist, there is some the same type of practitioners, the same type of doctors that you can see. $50 is going to be the member responsibility for the holistic premium, and then again that same $20 member responsibility, and the 5 and 2 premium and holistic and essentials number of visits per calendar year, respectively. chiropractic and acupuncture, it plays a big part in preventative care and wellness. So with that, the holistic premium, you have a combined 24 visits of chiropractic and acupuncture through for the year. You can split those 24 up between the two however you want. If you want to do all 24 chiropractic and no acupuncture, great. Vice versa, 12 and 12. However, whatever works for you. The member responsibility is going to be $35 per visit, but the visit itself is going to be covered at up to $175. So say you go to the acupuncturist and you're getting your needle work done and they also add on cupping. That is going to be covered at up to the $175 per visit. So even though it's in addition to the acupuncture that you went in for. The holistic essentials, chiropractic care is covered after your annual max is met under certain conditions. And what that means, and this is in the member guidelines, is that it would need to be related to a specific musculoskeletal need. So say you, hopefully not, but in the event you're in a car accident and your licensed practitioner says you need chiropractic care, that would be a shareable need. And so if you're on the ClearShare 1000 plan, you would, after you meet your annual max of $1,000, your chiropractic visits are covered. Acupuncture is not covered under the Holistic Essentials plan. So if that is something you're looking for, you're going to want to go toward the premium. Wellness products. So with both of these plans, as an individual, you are eligible for up to $50 a month, and as a family, up to $75 per month for a wellness reimbursement. We do have a list of what those things include, but it can be like a gym membership or things like that that help you stay well. Excuse me. So we can share out a list of all those qualifying reimbursements as well. For urgent care, there is a $50 in-network member responsibility and a $100 out-of-network member responsibility for holistic premium. And then holistic essentials, if you've met your annual max, it's $0. So again, if you met your annual max going to the chiropractor and you have to go to urgent care, you're done. You're covered. You've paid your $1,000. It's a shareable need. Lab work. A lot of naturopath practitioners that we worked with really want to start with a baseline, especially if you're a new patient, want to start with a baseline of where you're at with your blood work levels. And so those are covered at $10 for lab work in network, $25 out of network for holistic premium plus ClearShare. And the holistic essentials, again, it's going to be $0 after that annual max is met. Diagnostic testing, same type of a deal. Holistic premium is going to have some coverages for your diagnostic testing. So your MRIs, your x-rays, those types of things. With the holistic essentials, after your annual max, it is $0. So that means if you haven't had anything and you need to go get an x-ray and your annual max is $1,000, it will be your responsibility up to that $1,000. And after that, it is $0 because it is a shareable need. Same here. Some imaging, $200 in network, $400 out of network for holistic premium plus ClearShare, and then $0 again after your annual max for the holistic essentials. Hospital and emergency, which does include childbirth and delivery services. Both of these are covered under the ClearShare portion, and they are $0 after your annual max is met. Both plans do cover up to $500 per member per year of $0 generic medications. So if there is a situation where you do require medication, both plans are going to cover. You're going to be $0 out of pocket, up to $500 per plan, or sorry, per person per year. So submitting a need, Essentially, this is what you're going to do after you've gone to the practitioner, after you purchased your gym membership for the month and you want to get reimbursed for that. What you would need to do is collect the itemized bill, and you would go to this clearsharehealth.org/holistic need request, and we can share this out. We have info pages on how to access different things in a much more digestible, user-friendly form outside of the webinar. And you would just fill in a little bit of information here: the member name, the patient name, email, phone, primary member ID. And then you would upload your receipt. So you would need to put the date of service here, upload your receipt, and then you would be reimbursed within 30 days of submitting the request. So there's a couple terms on here. If there's care coordination or pre-payment or pre-approval, I'll get to that shortly, but those boxes are there as well. Okay, so ClearShare, this is going to be kind of an intro or refresher for those of you who've already seen this about what a health share is. A health share is a community of individuals who contribute collectively to help each other with medical expenses. So instead of saying you're paying a premium every month, it's your member contribution. Instead of saying a copay like we do with traditional major medical insurance, we're going to say it's your member responsibility. And as a member of this community, this is where once your annual max is met, the needs are shareable with the community. There are a couple of enrollment requirements for ClearShare. So primary members must be at least 18 years old and under 65 years old. Dependents can be on a parent's plan up until the age of 26. The holistic, I just want to call out to the holistic only. If you choose to do the holistic essentials only plan without the ClearShare with it, there is no age restriction. You can be 65 or older on the holistic essentials only plan. There is a tobacco surcharge of $50 per household if you are a tobacco user. Okay. So how needs are shared? Like, how does this work, right? A lot of people are familiar with the traditional major medical insurance. So you're telling me all these great things, and this is going to be covered after I meet my annual max, but how do I actually use this? Like, what do I do when I go to the doctor? So there are no restrictions to the providers you can access, and you can receive care anywhere. You do not pay at the time of service. What you're going to do is ClearShare shares in eligible expenses based on the usual, customary, and reasonable prices. So what does that mean? What you're going to do is you're going to give your ID card to the provider for prompt bill submission via the instructions on the card. You're going to essentially present yourself as a cash pay, and the provider is going to bill us directly. If your provider refuses to bill you directly or to bill us directly, you are not alone. You are not out of options. Do not leave your provider's office. You can call this number for help at the time of service. So you're standing in the doctor's office, you feel like you're all alone. They just said, we can't take your coverage. Call us, and we can help you at that exact moment. A lot of things that you know about in advance, like a procedure, or a surgery, things like that, we can help you get it set up on the front end so you have nothing to worry about but focusing on being well and getting through your procedure that day. So how needs are shared, continued. Needs are expenses related to the same medical condition are shared as one need. So say, for example, you are, hopefully not, but if you're in a car accident and you have some whiplash, but you also have a laceration on your arm that needs some stitches, that is related to one need because it stemmed from the one incident. So with excuse me, as an individual, the annual maxes are listed across the top. So as an individual, the annual max options are 1,000, 2,500, or 5,000. Member plus spouse, although you would be on the ClearShare 1,000 plan, the family out-of-pocket max would be 2,000. Now, this does not keep growing. If you have 6 kids, know your annual out-of-pocket max is not going to be $8,000, including the parents. There is a cap at $3,000. And this is for member plus family, which is a member, a spouse, and any dependent children. There is no, only one up to two. It's for the entire family. For the ClearShare 2500, the most an entire family is going to pay out of pocket is the 7,500. If you are an individual, it's just the 2,500. And then the annual max of 5,000, the family annual max is going to be 10,000. Now, why would I want my annual max to be $5,000 if I can get it for $1,000? Well, it's because your monthly contribution is going to be less. So your monthly contribution is less, your annual max is going to be higher. It is similar to how things work in the major medical world. Pre-membership medical conditions, there are some restrictions. So needs that you must be treatment free in order for a need to be shareable. You must be treatment free from it for 12 months prior to. The exceptions are for listed here: cancer, heart disease, stroke, and COPD. With those, there is a 5-year look back prior to the effective date of your membership. There are exceptions, more exceptions. So if you have something like high blood pressure, high cholesterol, diabetes, or hypo or hyperthyroidism, the limitation is that you just cannot have been hospitalized for those conditions within the last 12 months. You can be treated for them because they are needs that they need to be treated ongoing, but as long as you're not hospitalized in the 12 months prior to your effective date, those needs are shared. ClearShare has no restrictions on providers. You can go anywhere you'd like. These all say free after your annual maximum payment is met. So again, if you're an individual on the ClearShare 1000 plan, you can do hopefully you won't have to, but any combination of these that gets you to that $1,000, as soon as you hit that, you're done. If you have a family of 10 and you're on the ClearShare 5000 plan, your annual max is going to be $10,000 for the entire family. Once that is hit, you're covered, 100% shareable. In addition, both plans have free virtual health services. We have free 24/7 telemedicine with our partner called Amaze, and I use them all the time with my daughter who has a sore throat or comes home from school with pink eye. I just call them, they take a look and they say yep, and they call in a prescription for her. You skip the doctor, it is 100% free. It is amazing. Not to sound corny because their name is Amaze, but it is actually amazing. Along with that, there is some nutrition and wellness, some specialist guidance if you want to speak to somebody, speak to a specialist. Also, mental health. That is a big thing. I know I'm so glad people are talking about it more, and the taboo is less and less on mental health every day. There is free mental health support through Amaze as well. And you can choose if you'd like to text, call, video. It's really meeting you where you're at and your level of comfortability. The other thing I will note on Amaze is if other members of your household under the age of 26 are still eligible to use this benefit, even if they're not on your plan. So if you have, let's hypothetically say your niece is visiting and she gets a rash from something, you can call and you can show the practitioner the rash, and they can advise you, even though your niece is not on your health plan. She can still benefit from Amaze. Pregnancy and birth. ClearShare shares in services provided before and after your child is born. There is a limitation where conception that occurs prior to membership or within the first 60 days of membership. It is still eligible for sharing, but the cap is at $50,000. Now, for most, births where there's not complications, this is plenty. However, this is something that, you never know, and you want to take into consideration if that's going to be you. Please just note that the limitation is up to $50,000 if conception occurs prior to membership or within the first 60 days. Labor, delivery, hospital stay is free after your annual maximum payment is met. This does include C-section and any recovery needed at the hospital. Newborns whose birth is a part of a shareable maternity must be enrolled by the parent within 30 days of their birth. So that's exactly the thing you want to think about as healthcare when you've just had a baby, like, oh my gosh. But yes, please make sure if you're going to add them to the plan, you do it within the first 30 days. Care coordination. This is an additional benefit that we provide if you, it applies to surgeries, lab work, imaging, and other major procedures. So kind of like we were saying before, if you break your ankle and you know you're going to have a specific type of surgery, you call care coordination and you say, hey, I need this surgery. Here is, you can even provide them a quote if the doctor has given you a quote. But what care coordination is going to do on the back end is they're going to reach out to eligible high quality providers and essentially negotiate pricing. So if you go with the provider that care coordination recommends, and it is your choice to do this or not, but if you do go with the provider that care coordination recommends, we are going to waive your out-of-pocket costs for that surgery. So you could essentially get free surgery. We're not looking for providers that are not qualified. What we're actually doing is a lot of times the facility where the procedure or surgery will take place, they can negotiate pricing. So the same surgery, sometimes it's on the slide, the same surgery could be $40,000 at an orthopedic surgery center or $80,000 at a hospital. So by being able to change locations, even in some cases it's still with the same provider, we're able to save that much money. So we want to pass those savings on to you. Just a quick refresher. Yes, we do have the major medical plans available, copay plans, HSA plans, the MEC plans, as well as supplemental coverages. So dental, vision, accident, critical illness for you and your family. Are we running short on time, Crystal? Or over? No, we're good. Okay. I can share some more about that as well, and we can share the collateral with Aria and have them, share out with you guys as well. Let's see here. So care coordination, yes, you can. The care coordination, which is that potential to have $0 procedures, imaging, coverages, things like that. That is available on the copay plans. It is required to access the benefit for an HSA plan, as well as the MEC plan. MEC or minimum value plan, minimum essential coverage is what that stands for. So there are several major medical plan options. Can anybody read this? No, neither can I, but it just does show you the different, you can see the copays across the top, $3,500, $4,500, $8,000. There's an HSA plan and then the MEC, the minimum value plan. These are on the website as well, and you can look at these in detail. And it does, it covers what physician coverages, hospital services, prescription, all of the standard coverages that you would expect to see on the major medical side of things. So timing to sign up for one of these health plans. With ClearShare and the holistic options, there is no waiting period. Your coverage is effective the first of the month after your enrollment date. So you could enroll today or tomorrow and your coverage would start August 1st, which is next week. So that is pretty amazing. There is no open enrollment timeframe for the holistic and ClearShare coverages. The major medical, just as a refresher, is subject to an open enrollment timeframe. It is, toward the end of the year, the new benefits would start January 1. However, you can still sign up for them now if you don't have coverage and you want major medical coverage. There is a 60-day waiting period since we are outside of open enrollment. And again, that is only for the major medical plans. Just a quick summary. With the ClearShare, you have nationwide access. There is no network. An average of 30 to 60% savings off of marketplace average. And we want to add quality to your care. And we do have the white glove service, and we want to support you as a member of ARIA and a member of the Clearwater Benefits membership community. So to get started, you can get a quote online. You can also, again, like I said, book a free call with one of our benefits consultants and walk through your specific situation and have them recommend plans that fit your needs and your budget. Personally, especially with healthcare, since there's so many nuances, I would 100% recommend going the call route. They are not commissioned. They're not going to try to sell you anything. They just want to make sure you understand what healthcare coverage you're signing up for. And then with that, are there any questions that we can answer?
Don't think I saw anything come through, but if we do have anything, I'll definitely make sure we get it out to you guys at Clearwater to
Awesome.
answer away. Abby, we
Yeah.
appreciate you guys so, so much and everything that Clearwater has done for Aria, and being able to bring on this amazing member benefit. Like I said, this was kind of the baby that I brought into the Aria world with some other people. So this is a fun one for us, and we appreciate you guys. So with that being said, thank you to all of our amazing ARIA members who have joined us on this call today. Just as a reminder, we have ARIA National Convention, October 24th through the 26th in Las Vegas. Make sure you register because I think registration fees go up at the end of the month. So make sure that you guys are registered. I love the theme that this year of reinvent your brand. Right, like focusing on your brand. And I'm so excited to see how Aria kind of morphs all this into our national convention this year. So thank you, Abby. Thank you, Clearwater. And thank you to all of our amazing Aria members. You guys have a great day. Thanks, you guys.
Pleasure. Thank you.